What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we're going to talk about how certain doctors can change the workflow of the emergency room slash just the hospital in general. Both, even just for me as X-ray tech worker, you can tell my workflow and even the nurse's workflow. My lady's a nurse also. So one of the biggest things we notice is certain doctors are more notorious for ordering, I suppose, more than others. And some of the times it's not even their fault, but you can tell certain doctors order a little bit more. Like, let's say if their elbow is broke, it's hurt, right? They assess the patient, they order it. Certain doctors that are very, how do I put it, just assess, like they just order what's necessary, and think about Alara and think about other safety precautions, and just order, they'll order the elbow. That's it. Usually me as an X-ray tech, if I see that, and if I see something, obviously we can assess that it's fractured or anything like that, but if I see something that's wrong, of course I'm going to leave it open a little bit more. If I see something like on the AP, if I shoot AP on the elbow and I see that there's something obviously wrong with it, I will open it more and make sure that wherever said thing goes, fracture, whatever is broken, to make sure to get all of it on the other views, or I'll even repeat the first one to make sure, because our job is to make sure that we get the best picture for the patient so the doctor can assess them. Other doctors will order, let's say their elbow will be hurt, and they'll order a forearm, an elbow, and a humerus. And sometimes it's just the elbow that's broken. There's been times we've had all the way to a hand, all the way to a shoulder, and it was just the elbow. And it blows our mind that certain doctors will do that. I don't know if they're certain doctors have been known to they'll miss something, and that one, it went bad, and so they'll order above and beyond just to cover everything. And it just drives everyone in our department nuts. Certain doctors are more notorious. We can't say their name or anything, but it just happens. Even on the nurses, you can just tell when certain doctors are at your facility and they'll order so much, they'll start to literally piss off every single work. And I'm talking about everyone gets dragged through it. X-ray, nurses, respiratory, everyone gets dragged into it. Phlebotomy, everyone, and it astounds me how sometimes you'll be in a position where you'll have two doctors. One will be more who'll order above and beyond, and another one will be more chill. One time, literally, a doctor came up to us and was like, "I'm sorry that the other doctor, I'm trying to pick up as many patients as I can so you don't have to deal with this other doctor." Literally apologized to everyone. And sometimes we try our best sometimes with certain of these doctors to talk to them, be like, "Hey, what's going on? Why are we ordering all this?" Certain doctors are more negotiable, I guess. You're like, "Hey, I shot this is what I found. Do you really need all this?" And they're like, "Oh, no, it's fine. Just, with that one, it should be okay." And other one's like, "No, I want the whole thing." So you can tell how it can get chaotic at times, and it'll just backtrack everyone else who's in the workflow, other orders and everything. Just even on the floors, certain, it mainly will be residents, not even really doctors. When you'll be on the floor shooting exams, if there's a doctor with the resident, which, I mean, they're both technically doctors, but one is actual, an official doctor, and the other one's still a resident. if they're with their resident, with the doctor, usually they'll be more calm. And like they'll want to order something, and like the doctor's like, nah, we don't need that. Like, why are you doing this? Occasionally you'll go up there and you'll shoot something, and like the doctor will get mad at the resident for ordering something, and then you're just like looking at him like, I don't know what to tell you, doc. Someone ordered it, I came up here and shot it. And it'll be literally, especially overnight when there's less staff, constant running to the floor shooting stuff that can literally be waiting as morning ports, and it'll just make your job a little bit more harder. It's nothing that's crazy that you're just like, oh, they order like a bunch. It's like mainly just chest and KUBs, which is nothing difficult. But what tends to happen, especially if you're understaffed or just like a night shift where there's less of you, you'll like have to like go from the floor on one side of the hospital all the way to the emergency room, and then they'll order something, and you're just like back and forth, and then somehow in between all that whatever's going on, you have the like a stack of morning ports, which depending on where you work at, it can vary. Like ours, we have from like, right now we've been dealing with like 30 to 35 morning ports. And sometimes you could like you could literally, you'll just be nonstop. Usually overnight, for the most part, it's pretty chill. We don't really do much, like, and it's just certain days. If certain, like, there's certain days that we know for sure. Like, for instance, our hospital, like, if it's a Wednesday, we for somehow reason have a higher level of people coming into the emergency room. Certain times on the weekends we have a higher level, even though the emergency room is technically just R&D, just like random, like you'll never know what's going to come through. But certain days are just more heavily flowed with stuff. Like, I don't know, it's just something that if you pick up, you just learn. So if you have certain days that there's higher workflow or patients, and then you have certain doctors that are notorious for it, it will literally be so bad. You're gonna be tired. It's just something that just happens. The best advice I could give you in those situations is kind of like, if you're able to talk with a doctor and be like, hey, I shot this, I found this, and kind of you may be able to kind of like negotiate your way out of certain exams. And then there's other doctors like you'll go once and they'll tell you to, like, you have to do everything and there's no wiggle room, and you just have to just kind of go at your own pace, try to do everything you can, because like it will literally, you'll just constantly get flooded with multiple exams. Most patients that we deal with are older, not the most mobile. I would say 1 out of 10 people, 8 of those people are more older patients, probably 70 to 80, and most of them, they're not the most mobile. So like it takes longer. Usually a bunch of young people, they only come in for like usually flu and stuff, so it's just a chest x-ray, it's easy, or their tummy hurts, or little kids. Sometimes like, those are pretty easy. You even if they order a bunch, like you can knock it out in 30 seconds, like, you know. But the older people who fall and do other stuff, then that can it can go bad, because certain doctors are more heavily of, I'm gonna do x-ray and I won't do CAT scan, and other doctors are more like, they'll order a bunch of CAT scan and they won't order as much x-rays. So it all kind of also depends on that. Sometimes we will sit there and they'll order a bunch of spines and stuff, like C-spine, T-spine, L-spine. And I understand if they're young and they're able to kind of move, it'll be less radiation to get that way. Okay. But sometimes it'll be like older patients that can't move, and you know it's gonna be super hard to get all those images done, and you're like, it would literally take not even a minute for them to scan from like the C spine all the way to the L spine, and like with it, and just be done, and just pop them off and then continue on to the next patient, versus us with X-ray that you have to like individually shoot everything and make sure it's perfect for the rad or the best you can, and it will take like way longer. So once again, I'm here giving you this information just to try to help out someone in need who's coming into the field or who's curious about working at the hospital. That's stuff that you deal with. If you made it this far, thank you. I appreciate it. You can literally check out my channel. I literally post every single day just random little niche radiology videos, because like I feel like it's my duty to post back, to give back to the community, because not that many people post in our field. There's like, my lady's a nurse, and like if you do any like quick YouTube search on nursing stuff, like there's a vast amount of knowledge in them. No one does our field. No one really cares about it. We're like the Harry Potter, like bottom tier, like no one. So I'm here giving you the knowledge so you can be educated and like know if you want to do this, or if you're curious about certain aspects. I'm literally talking about very specific and detailed videos on certain stuff that if you're a student, most of the time your tech maybe won't inform you of this, or it'll be certain like very niche situations that will happen that if you do not know, especially at nighttime, if you're new coming into the field and something happens and you try to reach out to someone, they're like, most of the time the main department's all asleep, all the veteran techs. If they don't work with you at night, it kind of gets you in one of those situations where you're like, should I contact my manager? Should I not? Like certain situations. So if you know, if you learn from like my experiences, it can help you. That's good. So yeah, it's been your boy Miguel. See you on the next one.